recent research produced by Professor Leo Pinczewski and Associate Professor Justin Rowe in Sydney, looking at about 332 netball players in Australia over a 7-year period, showed that if you're under the age of 20, you're 3 times more likely to have a reoccurrence of an ACL injury following reconstruction. And the other really interesting data is that you have around about a 10% chance of tearing your cruciate ligament on the other knee, on the normal knee, compared to about 3% on your operated knee after you've had surgery. It's interesting when you look at those statistics and what can you tell from them. Most likely you're putting more landing force on the contralateral knee, on the unaffected knee post-surgically, and that's why you're more than 2 times more likely to tear your other side. And secondly, we also know that there's a familiar predisposition, a manufacturing problem that makes you much more susceptible to tearing your anterior cruciate, and that's why you're more likely to also tear the other side. Take-home message of all of this is that when you're rehabilitating ACLs post-surgery, we need to go through and do lots of hamstring strengthening on the other knee. We also need to go through and do a really good rehabilitation program on the affected ACL reconstructed knee, so that you feel really confident to land on the side that's been operated on and not just on the contralateral side. And we additionally need to be really careful with athletes under the age of 20. They're 3 times more likely to tear their ACLs. So they need a really good program in hamstring strengthening, teaching them how to jump, and most importantly, we need to get them back in the clinic after they've had a reconstruction every 6 to 12 months, literally for a 2-minute strength test to make sure that their hamstring strength is keeping up with their quad strength. Thanks very much.